Marketplace. Oh. What do you want me to say? Hi, my name is Jamie Nielsen. This is Mark Fontanella. Today we're talking about Transparency Tuesday. Mark and I are both in that life and health department of Hanson and Ryan, and we're going to give you some ideas about the need to knows about the what the hell? Why can't I talk about this? Mark and I are going to be talking about the need to knows, the key words and phrases you're going to hear that are going to help you during the open enrollment period. We are here to help you do that, but we're going to give you some of those. We're going to ask each other questions and give you some answers that'll help you navigate through that that time, open enrollment. All right. So my first question to Mark: what is open enrollment? Whether I'm 65, I'm under 65, anything like that. I just want to know what open enrollment actually means. If you could just break it down between the two, because Mark and I both know that there is a difference between anybody under 65 and over 65. But he'll give you the quick, what is open enrollment to people?
Yeah, well, I appreciate you asking that. So open enrollment is different than the annual enrollment period. So open enrollment is starting on November 1st and it goes to December 31st, typically for a January 1st effective date. Under the previous administration, they opened up the open enrollment period to extend all of January as well as a time where, hey, if I missed that enrollment time of both November and December, I had another month in order to pick my plan for the new year as an under 65-year-old individual, right? So that's open enrollment. Annual enrollment period is for anybody that is Medicare eligible, whether they're under 65 and they qualify for Medicare, they just turned 65, or over 65 and they're just looking to make sure their coverage still meets their needs. This is the period of time for both of those periods that they're able to change the carrier that they're with, whether the rate jumped, whether the coverage is kind of faulty, not really working for them, maybe the doctor that they were with left the network. These are all things that we can look at. It's all customizable for that individual person that we do the legwork for them. So that's the period of time.
One of the things I like to tell my clients is when you start seeing Dan Marino on TV talking about Medicare and all these big time, actors and actresses telling you Medicare is around the corner, open enrollment, annual enrollment period, that's the time you pick up the phone and call one of us. We spend our summers taking our certification classes, getting licensed for these things so we can actually speak to you on them. And we keep our finger on the pulse, basically knowing what's going on with all the carriers.
Right.
Some carriers are dropping out, which we learned this year, which is pretty big. So you want to make sure that your carrier you're with isn't dropping coverage and then pushing you off to another carrier without you even knowing. They can't do that.
Or leaving you uninsured.
They can't really do that, but the things happen. So you always want to keep your eye on those things. And that's what you have us for. All right. Next question. Question I like to ask is, what's the difference between Marketplace, Medicare.gov, and NJ Get Covered? I know this is a big slushy thing that we all kind of talk about here in the office because they all are all out there. Only certain things that New Jersey can use, only things that certain other states can use. So Mark is just going to give us a quick synopsis on what is the Marketplace, what is Medicare.gov, and what is NJ Get Covered, and who uses those.
Yep.
All these things, Mark and I are both licensed in. We both take certifications every single year. We take tests. Yes, we have to pass them or else we can't sell it. And we both are licensed in these different fields.
Yeah. Awesome. Yeah. So Get Covered New Jersey is what we know as what they called healthcare.gov. So under the previous administration, I've referenced them twice, they altered the Affordable Care Act law. So what happened there was it used to be healthcare.gov as a whole, where anybody in all 50 states would go there and they would be able to buy a plan as if it was Amazon.com. Since that enactment of the new law, right, there was a little bit of a change of that, they passed that power back to the state if they wanted to. Hence, New Jersey was one of them that created Get Covered New Jersey. So anybody does not matter what the income level is. If they want to buy individual private insurance coverage, they could go to Get Covered New Jersey and buy a plan, shop their carriers. Under 65, yes. So anybody that's under 65, they could go to Get Covered New Jersey. Dependent upon their income, they might be eligible for some sort of tax savings, what they call as advanced premium tax credit. Depends on the size of the family and the annual income projected in that year, what you're estimating for the year you're applying for coverage. So that's something that a lot of our clients do. Jamie, myself, and Alan are all certified in order to do that. Medicare.gov is basically like a self-serve site. So if you're on Medicare, you're, like I said, 65 or older or under 65, but qualify for Medicare, self-serve, you're able to go on there, type in your medications, type in the doctors and hospitals that you're looking for. They kind of give you a general synopsis of where, the plan that you're looking to enroll in looks like. And then, obviously you could decide, or some of our clients do that before they come and meet with us. They go on Medicare, they say, hey, Jamie, Mark, these are the plans that we found. What do you think of them? And then we narrow it down. It kind of makes our job a little bit easier, but we're able to, give them the overall oversight of their choice of plan for January 1st. And then the last question was, you said Get Covered New Jersey, Medicare.gov.
And the marketplace, you actually covered that
Got
in the
it.
beginning.
Yep.
Yeah. So the marketplace, Medicare.gov, NJ Get Covered,
Yep.
are all different things that you can go into as a client or as a customer or as a regular person. You don't have to be a client of ours, and you can do it yourself. These are all do-it-yourself things. The government gave you the opportunity and the ability to look at everything out there. Us as professionals, as I said earlier, we're licensed in this. We're tested every year. We have to do all that stuff. So we kind of know how to navigate those things a little bit easier than just a common person.
Mm-hmm.
So if you are trying to get through that, I suggest reaching out to us. Hanson and Ryan will help you through those things.
Yep.
And we don't charge an extra cost.
I was just about to say that.
Yeah, so we don't charge a fee. A lot of my clients come in and they pull out a checkbook and I'm like, what do you do? And they're like, oh, I got to pay for your time. I'm like, no, it's okay. We get paid a different way. We're here to help you, get through these things, and you will pay the carrier directly. Now, if you come with us, most of the time, I say most of the time because once in a blue moon they may throw something in there, but most of the time the price will not be different than if you went directly. So if you come with us and you get charged $100, you will still get charged that $100 directly with the carrier. The thing you do get differently when you go with us is you get our contact information. When you go direct with the carrier, you get an 800 number. So when you have our contact information, both of us, we use our cell phones. You can text us on a Saturday when you have a question. We're most likely going to answer you. You get our email addresses and everything. Get us directly. Where if you go direct with the carrier, you're going to get the 800 number, and you don't know who you're going to be talking to on the other end. So that's what Medicare, New Jersey Get Covered, Medicare.gov is all about. Next question. What is the importance of knowing your plan and your coverages?
Mm-hmm.
Like, I know people are silly, like, oh, you should know what kind of health insurance you have. I know what kind of health insurance I have, but why is it important for us to know that going forward? Some people are like, oh, just give me the best that you got. I'll pay the most money, and that's what I want. Well, the best sometimes isn't the best because it doesn't fit your needs. So why?
Yeah.
The question is, why is it knowing your plan and coverage is very important?
Well, very simply put, every year, as we've seen, carriers really get to choose to do whatever they want. They could jack the prices up if they wanted to without any sort of government intervention. They can have a dispute like Hackensack and another carrier had recently, and leave the network. So I think those are the two of the main points for our clients that we hear every single year is the price is either going up and the coverage is going down, or hey, my doctor's no longer a network, or my hospital that in the event of an emergency, I can't go and see. So it's extremely important to know that. And traveling outside of the state too could get a little hairy with some people where they think, oh, the person I talked to or the individual I spoke to at XYZ carrier told me I have coverage anywhere in the world. Well, that's sometimes not the case. So that's our job as well, is in order to look everybody up. The thing that Jimmy and I both do when our clients come in is we ask them for a full list of their medications, whether it be 1, 2, or 20. We look at that in our system and see what the best price is for those prescriptions. The other thing we ask for is a list of your doctors and your hospitals, the non-negotiables, right? Hey, I've been going to Dr. Jones for 35 years. I don't want to ever change him. You won't have to. Let's look for a plan that covers them. So in a couple bullet points there, those would be the things that are most important. Would be price, network, and obviously making sure that it's the best plan for your needs.
Most of my clients, I'm sure you're the same way, come to me and they're like, I've been with this carrier forever. I'm never changing. I don't want to go anywhere else. but it's getting expensive. What do I do? We're going to have to look somewhere else. And when we put you somewhere else, it's not like we're putting you in
Yeah.
like the No Frills brand, or, we're not putting you in something substandard. We do our due diligence to make sure you have the coverage. We actually, and I know Mark has done it, I've done it myself, call the doctors directly and say, do you take XYZ? Because I have client here who says they want to stay with you, and do you take this coverage? And we get the confirmation from the doctor's office directly. So the client sees it. These are just little things that we do.
Right.
It's not called upon us to do it. We just do it because we know our clients we want to make our clients have a better experience by doing that
Right.
stuff. My last question, we kind of answered it already in one of the previous questions, but I'm going to go at it again only because I hear this a lot when I'm out and about is, oh, I'll go direct with the carrier.
Yeah.
Why do I need to use you? So in your words, Mark, what is the advantage of going direct to the carrier and possibly going with us as a broker or agent?
Sure. Like Jamie said before, the price doesn't change. The cost that you're going to pay going directly to the carrier, as opposed to the cost that you'd pay with going with Hanson or Ryan, whether it be Jamie, myself, or Alan Mix, it's all the same. It's in New Jersey, it's age rated. So no matter how old you are, the rate will be the same if you were to go directly to the carrier or as if you would come and work with us. The thing that we do that Horizon, United, any of the carriers that we represent don't do is you don't have a single point of contact. If you have something where you want to go in and change your payment method, or just recently we had a client, or I had a client that had some fraud on their credit card. They needed to cancel their credit card. Hey, if there's no credit card tied to their account anymore, their premium payment's going to bounce. Coverage is going to get canceled. So we do very simple things like that. You need an ID card, we get it for you. You need to change your payment, I do it all the time. Anything like that. Hey, Mark, can you tell me how much this prescription would be if I went to CVS? Done.
Now, if I was direct with a carrier, how would that? How do you think that would? Well, we know how.
We would, you most likely would be on hold for an hour. You wouldn't get that time ever back in your life. But that's
You're going to get that person that plays they have the cut sheet in front of them. So
Yes.
when they ask you a question, you have to keep repeating yourself, and let me ask again. We get your gripe. We understand what you need. We go forward and we do what we got to do.
Right.
Where if you went direct with the carrier, like you said, it would be on hold. There'll be countless times you have to repeat yourself.
And even if we didn't have the answer right on the spot,
right,
we say let's talk directly to our carrier contacts, where we have a direct path right to somebody that can help us with any of your questions. So hope that cleared it up.
I know this Transparency Tuesday went a little long. I hope that if you have any questions about open enrollment, about Medicare.gov, about NJ Get Covered, anything about your health insurance, coming up, you're able to make those changes. Remember, if you miss that window, you can't make changes for a full year after that. There are some caveats to it, but I'm just going to tell you can't change. So if you haven't changed, or if you feel that you're paying too much or you're not in the right coverage, open enrollment is going to be a time for you to say something to anybody. It doesn't have to be us. Go direct to the carrier if you really want to. But we appreciate your time.
Yes.
And hope to hear from you guys. You got anything?
Listen, we're in person. We do phone calls and video calls. Make ourselves very, very contactable, if you will. But thanks so much, Jamie. Thank you for your questions, and looking forward to seeing you from you guys soon. Thank you so much.
Thank you.